Hi, everyone. Thank you so much for being here. I'm Jonathan Lynch. I'm the Deputy Associate Director for Communications in CDC's Division of Environmental Health Science and Practice, which is part of the National Center for Environmental Health. I'd like to welcome all of you to today's Environmental Health Nexus webinar, Wildland Fire Activities in State, Tribal, Local, and Territorial Public Health Agencies. Today's session will feature a presentation followed by a Q&A session with our panelists. Please note that all participants are in listen-only mode, and closed captions are available for this webinar. Next slide. Today's webinar will be available to view on demand in a few days. You can find the video recording of today's webinar at the CDC Nexus webpage at https://www.cdc.gov/EH-Nexus, or you can scan the QR code. Okay, next slide. You may submit questions at any time during today's presentation. To ask a question using Zoom, click the Q&A button at the bottom of your screen, then type your question in the Q&A box. Although the chat box is open, that's more for making comments, please use the Q&A box for questions. Please keep in mind that we often get more questions than we can answer in a live session. If you're a member of the media and you have a question, please contact CDC Media Relations at media@cdc.gov or by phone at 404-639-3286. Next slide, please. Please note the findings and conclusions in this report are those of the authors and don't necessarily represent the official position of CDC. Next slide, please. And I want to welcome our presenters for today's Nexus webinar. We're pleased to have with us Captain Antonio Neri, Chief Data Scientist at the National Center for Environmental Health in the Division of Environmental Health Science and Practice, Lori Copen, Chief of the Exposure Prevention and Education Section at the California Department of Public Health, Leah Hoffacker, Director of Public Health Emergency Preparedness and the Health Protection Division at the Georgia Department of Public Health, and Carolyn Helson, Climate and Health Program Manager in the Division of Environmental Health at the Michigan Department of Health and Human Services. Thank you to all of our presenters for being with us today. Now I'm going to turn it over to Captain Neri. Tony, the floor is yours.
Thanks, Jonathan. My name is Captain Antonio Neri. I'm the Chief Data Scientist at the Division of Environmental Health Science and Practice, as Jonathan said. I wanted to, first of all, appreciate our speakers for being here. This has been a session long planned since early parts of this year when CDC hosted the Wildland Fire Leadership Council in Atlanta, Georgia. And that came about as a request of CDC getting involved both in the WFLIC panel, but also the Wildland Fire Management and Mitigation Commission report, which was a congressionally commissioned report to federal agencies as to what could be done to address the wildfire crisis. I'll post a link in the chat in a moment to show the entirety of it, but there's chapter 2 is the public health section for the Wildland Fire Management and Mitigation Commission, covers public health, and then talks about the absence of funding, federal funding, dedicated federal funding for public health in the wildland fire space. Secondarily, I'm hoping we get a lot out of the last week's session too. It will be posted for recording. The recording will be posted soon, but it talked about the Public Health Emergency Preparedness Grant that CDC had, and the wildland fire is specifically noted in it, and it has a significant amount of funding for state, local, tribal, and territorial health agencies. And then finally, I wanted to highlight the Community Wildfire Defense Grants that are available through the U.S. Department of Agriculture and U.S. Department of Interior. With that, I'll hand it over to Lori in California. Lori, the floor is yours.
Hi, everyone. Lori Copen here. Thank you for the invitation to speak about risk communication and wildfire smoke exposure. Here at the California Department of Public Health, we are developing a wildfire health plan that requires that we create guidelines for communicating with the most at-risk Californians, who may be those who are low income, low educational attainment, marginalized, excuse me, or disadvantaged Californians. And our charge is to communicate with this group about the hazards of wildfire smoke and how they can protect themselves. Next slide, please. So just as a basics, this is one definition of risk communication. And it's important to understand that all approaches to risk communication must consider what works given the audience, a situation, and the purpose of the communication. Risk communication including risk communications is crisis communication, or what you do in an emergency, but that's not what our plan is about. And important to emphasize, there is never one right solution. This is confirmed by many theories, approaches, and practices in risk communication. Next slide, please. So the challenges of risk communication are threefold. There is the knowledge challenge, or what's the technical aspect of what we're communicating. There's the process challenge of who are we communicating to and how are we involving them in the communication. And there's the communication skills themselves. And this is how do we effectively communicate. Constantly in our communication, we are balancing technical knowledge against the values, beliefs, and emotions of our audience. And if we never involve the audience in our communications to understand what they understand, how they interpret our messages, we'll never know what they feel, and we'll never improve our messages. Just a note of seriousness about the literacy level in the United States. It is a terrible problem. We have over 130 million adults who are not able to read a simple story to their children. We have 1 in 5 American adults who are functionally illiterate. That means they can't really follow instructions on a prescription bottle. And we have more than half, 54% of adults who have a literacy level before a 6th grade education. So we really need to make sure that this technical knowledge and understanding our audience is first and foremost when we're thinking about what messages we're putting out there, particularly for the difficult to reach at-risk communities. Next slide, please. This is about a theory of convergence and consensus, which you can read here on the slide. The big important message here is if we don't involve the audience, if we do not ask them what messages mean to them through dialogue, our messages are doomed to fail. This is played out in many different risk communications. And I believe, and through multiple interviews with a variety of organizations, we've learned that really we do a pretty poor job of testing our messages with the people who need it the most, the people who are socially marginalized, economically marginalized, and may not have the option of seeking shelter elsewhere or not going to work. So this is very important. And the last, next slide, please. So this is just a very quick slide to help you understand that, and I think we all intuitively know this, that trust is earned in drops and lost in buckets. So when we think about testing messages, when we think about how to communicate with particularly at-risk communities, we need to think about doing this through trusted intermediaries. Next slide, please. So as part of the process for developing these guidelines about how to communicate risk around wildfire smoke exposure to low-income marginalized communities, we did a little survey last summer. It entailed 176 interviews, mixed methods, meaning some qualitative and quantitative messages, And it was with a low-income, racially diverse, at-risk community members. And we did that through trusted community-based organizations. I'm going to present just a few of the preliminary quantitative slides. And I have to say, with the clearance process, these slides have since been updated, but the graphs reflect an older interpretation. However, the veracity of the information remains the same. Next slide, please. So when we look at the sources of information used to that community members used, we see that there are various sources, and this reflects best practices, which means we can't rely on one type of modality for communicating wildfire risk messages. We need to use a variety of methods to do that. And, you know, very important to know that most people will turn to television to learn messages, to understand what's happening with wildfire smoke in their areas or wildfires. And surprising to us was that people generally used, almost half of the people we queried, generally used their phone app for to understand what the air quality was. They weren't going to airnow.gov. They weren't using an app for airnow.gov. They were going to their weather app on the phone. Next slide, please. And this talks a little bit more about that issue. When we specifically asked about the use of websites and cell phone apps, we found that 2/3 of the respondents said that they had used mobile apps or a website. That's 63%, which means almost 40% do not use airnow.gov or use other mobile apps or websites, and that there are noticeable differences how this question was answered by age, with 3/4 of respondents between 15 to 45 years old using either a mobile app or a website, and only 1/4 of those 65 years old or older reported using technologies. Now, recalling that people who are 65 or older are some of the most at-risk populations in terms of being sensitive to the effects of wildfire smoke. We really have to diversify our messages and diversify our modalities for communicating these messages. And last slide, please. Maybe it's not the last slide. It's not. Last 2 slides. No, you can go back. I apologize. So just a note that people prefer that and heavily advocated for the use of text messaging around alerts related to wildfire. This is the most accessible and most timely for people in our subset. And last slide, please. And I would have to say that this is a very disappointing slide, with the blue being those who answered yes to using this variety of masks in California, and the N95, which is the standard bearer of messages that we communicate, use an N95 to protect yourself from wildfire smoke exposure. Only 37% used of our population used an N95, even a smaller amount used KN95, but most people use surgical masks and some use bandanas. So we have to do better with our messages. We have to figure out how to get more people to use N95s or KN95s, and that is the end of my presentation. And thank you very much for giving me this opportunity.
Go to the next slide. And I'll hand it off to Leah Hoffacker.
Good afternoon, everyone. My name is Leah Hoffacker. I'm the Director of Public Health Emergency Preparedness in the Georgia Department of Public Health. And I'm going to focus on what the public health emergency preparedness role can be and our department can be in supporting wildland fires, prescribed burns, and communication. Next slide, please. So the Georgia Department of Public Health, we are the lead agency for Emergency Support Function 8, Public Health and Medical Services. That being said, the Public Health Emergency Preparedness Program is responsible for coordinating our office's responses to support emergency response in the state. So we focus on communications, environmental health, epidemiology, nursing, and emergency medical services, as EMS does fall underneath DPH in our state. We have environmental health strike teams that can support wildland fire responses. Epidemiology can help track impacts of smoke inhalation throughout the state with our Sentinel services. Nursing supports our shelters in the event that we need to evacuate and support sheltering of our individuals. And our emergency medical services, obviously, with transport of those that are injured or are being impacted by smoke inhalation during a wildland fire. What I'd like to focus on right now and what we've been doing most work on is that communications piece, as Lori was just speaking about. We work very closely with the Georgia Department of Natural Resources and the Georgia Forestry Commission. We are focusing on trying to educate our locals, our district public health emergency preparedness coordinators, our healthcare coalitions, and the general public about prescribed fires in the state of Georgia, how they impact the state, share that messaging that DNR shares to their social media platforms by sharing that through our platforms so that we can reach the populations that follow public health and provide them with additional information about how to protect themselves and why prescribed fire occurs in the state of Georgia. By doing this, we're able to, I'm sorry, by doing this, we're able to educate people in the state of Georgia about a prescribed fire. We're able to reach populations, particularly those that are going to be more higher impacted, by working with the Department of Human Services Division of Aging to reach our elder populations, and particularly going through our healthcare coalitions and those long-term care facilities and our healthcare facilities to educate them on prescribed fires in their areas and how to protect themselves, how to use the correct filters, and how to communicate with their populations that they can reach. We believe that supporting DNR and the Georgia Forestry Commission in prescribed fire burns is going to be very beneficial to the state of Georgia, and we're happy to be partners with those. And without any questions, that would complete my presentation.
All right, I think we can go to the next slide. Hi, everybody. I am Caroline Helson, Climate and Health Program Manager for the Michigan Department of Health and Human Services. Today, we'll be talking about Michigan's response during the 2023 Canadian wildfire smoke incident. So next slide. So when the smoke reached Michigan in June, it was really an all hands on deck effort to respond. So here on the slide, you'll see three different categories. First, we coordinated with the Department of the Environment, Great Lakes, and Energy. We call them EAGLE. They're meteorologists to receive air quality updates. Then we had to really figure out the best way to get that information out to the public in a relatively short time frame. And then lastly, our epidemiologists used syndromic surveillance tools to monitor emergency department visits across the state. Next slide. So EAGLE, the department I just mentioned, so they collect the air quality data and produce forecasts. As it relates to wildfire, the role of DNR in our state is largely local, so they monitor local wildland fire and share fire prevention communications with the public. And then Michigan State Police, they coordinate with county level emergency preparedness managers, so open communication with them was really critical. And then on the left, you're seeing a map of air quality monitoring stations across Michigan. So the data are shared on airnow.gov, and EAGLE last summer, they shared same day and next day alerts on PM 2.5, which were based on 24-hour averages averaged across large geographic areas. So a statewide alert for orange on healthy for sensitive groups means that some areas could have been higher, some could have been lower. So this complexity combined with the dynamic nature of the wind patterns moving wildfire smoke across the state really, I think, made it challenging to prepare geographically and craft really targeted messages and public health actions for different localities. So with that in mind, the department really planned messages to be on the more protective end and promoted general preparedness actions the public can take, such as 1, monitoring your chosen weather app, the air quality information within your chosen weather app, or airnow.gov. 2, signing up for those EnviroFlash alerts so you can just get them straight to your preferred method of communication. And then number 3, making choices to reduce your exposure to PM 2.5. So we really emphasized exposure reduction. Next slide. Part 2 of the effort focused on communicating that information. So once we sort of were coordinating with all of the different agencies, we decided to form a local health department agile work group with environmental health directors, public information officers, and other staff from local health departments across the state. And then we really looked into who are we coordinating with internally within the department who needed to be engaged. So there was, of course, the Division of Environmental Health and our Bureau leadership, but also the Bureau of Emergency Preparedness, our senior public health physician, and teams serving higher risk populations, such as the asthma team, cardiovascular disease, maternal child health, aging and homeless services. And that's where we really got to have a much broader reach into the community organizations to get feedback from community members. And with that group, so we produced several of the outputs on the right-hand side of your screen. First was a web page that just had comprehensive information on wildfire smoke and health, which I'll go over on later. 4 press releases, a series of social media posts, 3 health alert network messages within that June 26th to 30th timeframe. And then we also had an environmental health hotline. It was open Monday to Friday, 8 a.m. to 5 p.m. And I think that was a really helpful resource for people to get questions answered over the phone. Next slide. So this slide shows the 5 sections included on the public webpage, and we really prioritize messaging at the top for who is most sensitive to wildfire smoke. And then there's a section explaining what are the health effects of this smoke, why should you care about this issue. And we really looked at airnow.gov resources, the available literature, and other states' work to inform our activity guidance. So that's both for, we had a section on sensitive populations and also for schools/daycares and guidance for healthcare providers. And related to the guidance on activities, other than reducing physical exertion, guidance included information on like what to do with your HVAC system, those MERV 13 or higher filters, using those in your system, creating clean air rooms, DIY air cleaners, and masking. So I think really thinking about the holistic approach of all of those different avenues of action. And then lastly, that call to action at the end was really encouraging readers to sign up for those EnviroFlash alerts. Next slide. So here you're seeing a graph depicting PM 2.5 concentrations in green on the bottom, and then the proportion of emergency department visits with asthma as the chief complaint in blue at the top. So Michigan monitors first reached red on June 7th, and the highest readings were on June 27th and 28th with that purple level, which aligns with the spike you're seeing in ED visits, the blue line on the top. And then on June 29th, all monitors across the state were red. So our epidemiologists use Essence as our syndromic surveillance platform. Keywords included, at first, keywords included things like asthma, bronchospasm, reactive airway disease, looking at both chief complaint and discharge diagnosis. There's a Essence query titled Air Quality Related Respiratory Illness version 1 in the platform. So there are lots of respiratory related keywords there. But then we also expanded our view into the platform to look at cardiovascular related visits. So what are we picking up related to cardiac alert, chest pain, congestive heart failure, myocardial infarction, and heart attack? So that was just a comprehensive look at sort of what was going on. And at the time, it was 146 out of 149 EDs were submitting data voluntarily into the system. Next slide. All right, so now here what you're seeing on this slide is lessons learned. So there are really 5 main ones. The first is just establishing regular communication with Eagle regarding air quality. So they send periodic updates to us outside of wildfire and heat season related to air quality. But during the season, they were sending forecast updates twice a week. And this year they established a 2-tier system where they'll send an advisory out for 2 or more monitors at the orange level and alerts for 2 or more monitors at red or above. And second, we continue to meet with that local health work group monthly to keep air quality and other climate-driven hazards really at the forefront of their mind. We use existing resources like the NIFC wildfire outlooks and the Canada CIFFC situation reports. I can drop those links in the chat later. And then number 3, since forecasting for wildfire smoke patterns can be really complex, just really thinking about the general preparedness action, promoting those actions out of emergency response times. Like this year, for example, we sent out a proactive air quality press release in May before really anything got started as it relates to wildfire smoke. The last 2, so number 4, we continue to prioritize the MDHHS teams and community partners that serve higher risk populations. So meeting with them, presenting to them throughout the year. And then lastly, I think while we can promote the ideal messaging related to HVAC systems, like closing outdoor air dampers, using those high quality filters, many systems are not able to handle MERV 13 or higher, like thinking residential home systems. And many individuals may not understand very well how their HVAC system works. So there's still more, I think, to think about there and really expand our work into how we're recovering most of the state in terms of their ability to protect themselves, especially as this topic becomes increasingly important when considering heat events occurring at the same time as smoke events. So more to come there. But we learned a lot last year and are really grateful for all of the federal resources and the other states who have, way more experience dealing with wildfire smoke traditionally than Michigan does. So we were able to really tap into all of that to support our response efforts. And next slide. So this is just the end. You can learn more at michigan.gov/climate and health, and my email address is there, helsonc@michigan.gov for questions. Now I will pass it off to the moderator.
Thank you to all of our presenters for providing our audience with this important and timely information. We'll now go into our Q&A session. To ask a question using Zoom, click the Q&A button at the bottom of your screen, then type your question in the Q&A box. We often get more questions that we can answer in a live session, but we'll try to get through as many as we can today. I would like to ask Captain Antonio Neri to join me in moderating this session. Tony, the floor is yours.
Thank you. Leah, I see the first question is for you. Can you read that off? Do you want me to read it off?
I'm happy to read it. I have it in front of me. This is, of course, my FET project officer, Denise. So for Leah Hoffacker, can she please explain a little more about how she uses DNR messaging and whether she adds a public health spin to it? Does this go out on the PH social media? I haven't seen what their messages look like, and I'm curious what they put out. Thanks. So, and I see that Shan Kamek with DNR is actually on this, who I coordinate closely with for the messaging. So what our intent is that in the state of Georgia, our governor actually declared an annual prescribed fire week. So one time a year, the DNR can put out a lot of messaging to go ahead and inform the community about what prescribed fire is, how it works, how to register, all of those things, and then the kinds of things they can do to protect themselves as a community, and just for general awareness and resources for how to find out more information. What Shannon and I had discussed was that DNR's population that they're going to reach is going to differ than what public health population is going to reach. We're going to have different followers on social media. We have our health departments and our clinics. There's just different ways that we reach the community. So the intent is to take DNR's messaging throughout the year, take it to a DPH platform, and yes, then he's added public health spin to it. So add additional resources for public health about, like Lori was talking about with N9, to try and increase N95s and mask usage for the populations that can be impacted by the smoke the most, where they can get more information from us, the types of individuals that may be impacted with those with kind of respiratory illness and the things like that. We're also able to share that kind of messaging with our healthcare coalitions. Like I mentioned, we have very robust healthcare coalitions in the state, and we're able to reach long-term care facilities, assisted living, all of our hospitals, dialysis centers, mental health facilities through the Department of Behavioral Health and Developmental Disabilities and our community service boards to be able to share the same messaging that DNR puts out, be able to reach a different population, and then add our spin about mental health, personal protection, and just additional information that our populations may want to have. And I think that'll answer the question.
Thank you. Caroline, do you want to take the next question?
Yeah, I can do that. So the question is, Caroline, was there any thought given to expanding the time for the call-in line that was apt to go into the evening or weekend? Yeah, that's a great question. And we did that through partnering with Michigan 211. So 211, that they really helped us expand the coverage for those hours outside of the times that I noted for the hotline.
Thank you. Did you want to take, there's one at the bottom too while you're on camera.
Yeah, so the other one has to do with how has Michigan dealt with smoke preparedness during prescribed fire smoke events? So here we really lean on our partners at the Michigan DNR to share that information out with the public. They have great resources on their website. As far as the health impacts go, we provide like general health and safety information to agencies conducting the prescribed burning. So us sharing that information with them, making sure that we have, you know, folks within that team that we are regularly connected with. But again, like I said, DNR does a really great job at sharing information on their channels as well.
Thank you. Lori, there's a question there for you. If you want to take that.
Yes, there was a question I answered already, which was how many people did not wear a mask at all. And that, if my memory serves me correctly, that was about 2%. I'm not seeing the question. Oh, wait, I'm not seeing the question, Tony.
Oh, I can read it off. It said, regarding the survey on mask type usage during California fire events, was qualitative data collected regarding availability of masks types compared to the participants' understanding of effectiveness?
Yeah, so this was a survey to try to understand what behaviors were practiced, what were this experience of the audience during the last few wildfire events. So we didn't ask anything that was kind of information gathering to compare to the kinds of questions that were the caller is, or the participant is posing. However, this is not the end of this work, and we hope to both present what we're doing in possibly in the fall, what the results are overall, qualitatively and quantitatively, and we will also be collecting more information as we go forward, developing guidelines, and maybe we'll be collecting some of the information that's being posed.
Yeah, question for, let's see if there's other ones in here. I had a question more for you, Lori, to talk a little bit about the space that public health gets involved with post-fire recovery in communities. I don't know if you had any experience with that or could talk a little bit about that. And I think that's an area where public health, my experience with it from the Wildland fire side is that the response agencies are very adept at coming and responding, but when the communities get destroyed, that becomes a very different cast of folks helping. I was wondering if you could talk a little bit about public health's role in your experience, if you have that.
Yeah, I don't have that experience. We have a lot of different segments of preparedness, recovery, and response and recovery in California that are handled by different agencies. But as we all know, as government agencies, that all issues, all crises are local. And I can't speak to that, but thank you for the question. And also, I would say that the tenets of good communication that I brought up are as important in the recovery phase as they are in the preparedness and response phase.
And I was wondering if each of you could talk a little bit about what you saw for the future of public health involvement. And some of you touched on different parts of it, but I was wondering, and Lori, if you want to start, you can. You touched on it a bit as well, but if you could each talk a little bit of what you thought you could do if you had additional funding. I know funding is always an issue, but what you anticipated having to do or could do in the future.
Yeah, thank you for that question. Literacy in America is not improving. As I said, 54% of the population reads below a 6th grade level, and 1 in 5 are functionally illiterate. So if we are going to do effective public health outreach and education and response, we need to be sensitive to the needs of folks. So I would hope to see in the future much more qualitative research about how we can do a better job in public health at getting those most at risk, most in need, to be able to understand the kinds of messages we have been, we do a very good job at communicating for each other and communicating for the general public. We do a poor job at communicating for those who are in most at risk for the effects of wildfire smoke exposure. So much more is necessary, in my opinion, and hopefully with the help of CDC, that would be a possibility in the future.
Thank you. Carolyn?
Yeah, I think as you know, I showed the map related to air quality monitors. I think it's really important to expand our state's ability to monitor air quality. So just more of those regulatory monitors across the state. For the non-regulatory efforts, like outside of Eagle's work, the low-cost sensors are also an option for locals. And then the second one I think is really related to it's like an expansion of what I was talking about for the HVAC system. So we need more access to clean air, climate controlled spaces. Like I was saying, if like air quality events are happening at the same time as heat events, those cooling centers, we want to make sure that they're also prepared to be clean air centers. And, not just having those centers set up, but our schools, making sure that, our schools equipped to have clean air during these types of events, or residential homes equipped for that. And there was an interesting comment in the chat earlier about how masking, especially like N95s, might be difficult during like strenuous work activity. So I think that just underscores the importance of bringing all of these different actions together, and perhaps like there's some opportunity for really thinking about clean air rooms for workers to take breaks, having the opportunity for those workers to take more frequent breaks in cleaner air. And then lastly, just a better early warning messaging, so we can get to that vulnerable group that Lori is talking about. So like I said, last year, Eagle was sending us same day and next day forecasts. Now we are getting sort of like a weekly view. So that helps us a little bit more for preparation. I mean, of course, there are limitations related to how you can forecast, but as much as possible, how we can really monitor this across the state and across the country would really be beneficial.
Thank you. Leah?
So concur with everything that's been said before. I mean, I completely agree, especially with the post-event and having to have these safe spaces for these individuals to go. We're seeing the same problems with the N95 comment. We're seeing the same problems with the N95s and our poultry and farm workers right now during H5N1, right? It's too hot. So they don't comply with wearing it because it's too hot. So like Carolyn was saying, finding alternative ways to find a way to give them more opportunities to be in a clean air space that's got a temperature controlled environment. What are they willing to wear that can provide some protection that they're more likely to comply with for longer periods of the day. And then really looking at those sheltering events and ensuring that whether it's a school or if it's a YMCA or we use our technical colleges occasionally, are they outfitted to actually with the appropriate air filters and the HVAC systems, and are they prepared to be able to provide a safe environment for people to shelter? And do we have long-term housing for those kinds of things? So those are a lot of conversations we have to keep having to make sure that we have enough space that's appropriate for these kinds of responses. And then I think it's important, I mentioned the mental health aspect earlier, but it's important to think about fire's scary to people, not just the smoke, but where there's smoke, there's fire, right? So it's more than just, the impacts to their health, it's the impacts to mental health, both for responders and for the community that's being impacted. So ensuring that we create that relationship between our mental health providers and our wildland fire services and our DNR partners to make sure that that messaging is being out there and that our providers are able to support the mental health of individuals impacted both during and after the response is incredibly important. So I think there's still a lot of space to do that. In fact, Shannon, I know that you're on. I'm sure I'll be reaching out to you soon to try to make that connection and make sure that we're providing that. But mental health and any kind of recovery center is essential. So making sure, though, that mental health is actually being geared towards this kind of response is going to be really important.
Certainly. There's a question about what kind of information can forestry and wildlife agencies share with health agencies to support exceptional events demonstrations. Any of you want to talk about that?
I think I can start to address that because we started talking about it. This kind of goes along with what we're trying to do with prescribed fire and communications in Georgia, and the path that we're starting to go down is understanding first, a lot of education about what exceptional events demonstrations are ahead of time, like understanding this environment and what those requirements are, why they occur, and then understanding, making sure that we get the information very early on, and then we're able to communicate with our partners and our local communities and our health departments and our healthcare facilities about that event, and to make sure that we're doing the right, providing the right information locally so that they can support that. And we want to make sure that people understand we need to find a way to be able to tell our people locally what an exceptional event demonstration is, what tell our communities and our residents, understanding why it happened, how that occurs, what steps they can take, but to also try to mitigate that fear and kind of over response to it by providing information early and in a way that's easily understood by our locals.
Thank you. Carolyn or Lori, anything to add to that?
I can just say, though I don't remember all aspects of the report, one of my colleagues before retiring the last 5 years or so did some public sessions with rural communities around prescribed fires. And once again, what was brought up there is that it's really a communication challenge. That in California, we do have apps, Smoke Spotter and others, that will tell you where there is a prescribed burn. But if you are, and this was, I believe, an older population, again, coming back to the slides, that not everybody is able to access not able to access a website or an app. So I think what she found, and this is Sumi Hoshiko and Andrew Rosenberg and other colleagues, is that we need to do a better job at communicating that there is a prescribed burn, particularly those who are potentially marginalized from a communication perspective. We all understand how frightening it is to think that there's a wildfire and what might happen when we see smoke. So just that, for me, as somebody very interested in risk communication and community responses, it seems like we all can improve in all aspects around communication modalities, and Leah referred to this as well.
Yeah. Carolyn, any thoughts about exceptional events?
Yeah, I mean, I think what Lori and Leah shared is really spot on, and I think overall we have not gotten too many inquiries from the health department side related to prescribed burns. I think it's likely on a smaller scale compared to other regions of the country, but really advocating for that local air quality monitoring, make sure that people are understand and are receiving information, to the level that they're able to act on it in terms of what the air quality is in their area, so that regardless if it's a prescribed burn or if it's another source of PM 2.5, that they're ready and able to adjust their activities accordingly.
And in particular for exceptional events, it could fall sometimes on the public health agency and the air resource board or the air boards that talk about PM 2.5 exceedances. Any experience of you all working with those boards, Leah or Lori or Carolyn? I can't hear you.
Just saying, I don't have any experience or anything to report out about that.
Same here.
No problem. Let's see. A couple things about Nexus in the chat. Let's see other ones. Do you see anything in there, Cagsy, that I'm missing? Active today.
It looks
Tony,
like you
it
got
looks like there's, one more in the Q&A.
Oh, about when messaging to the public or answering questions about the benefits of prescribed fires, are the benefits of prescribed fires mentioned or inquired about? That might be a Leah question. I think you might have answered a bit about that. Anything to expand on?
So I'm trying to figure out, making sure I answer it a way that makes sense. Is the question kind of like, is it asked about, or people asking about what the purpose of prescribed burn? I mean, that is a huge part of the messaging to our residents, is why we support prescribed burn and why prescribed burning is so important in our state. I hope Shan won't mind, and I can put the link in the chat. There's some great YouTube videos that Georgia DNR has done with Burner Bob. He's a cool dude with a hot message, but it's this great video that you can watch, and it's on YouTube, and we can share that. We share that with the within the state DNR has, and I'm hoping that we'll get to share it as well. That it explains the purposes of prescribed burns, why it's healthy for the environment to do prescribed burning, why it's actually why it's safer to do a controlled burn than to allow the trees to catch fire on their own when they want to and how they want to in an environment that's not going to be safe for that kind of a situation. So, so Tony, if you want me to, I'll go ahead and put the link in the chat. I pulled it up when I saw the questions earlier, but it's a huge part of the messaging is to make people understand that this is not make them, but help them understand that this is something that's good for the environment, and it's also good for our communities, and it'll help protect them. So yeah, that's a big part of the messaging.
Perfect. That would be great. Yeah, I'd appreciate that if you could do that.
Mm-hmm.
All right. I think that covers us for today, and we're coming towards the top of the hour. I might hand it back to Jonathan to close us out, unless anyone, Leah or Carolyn or Lori, have any closing statements you'd like to make before we hand it off. We really appreciate everyone's time, Leah and Carolyn and Lori, and representing all your agencies, and particularly the Nexus staff for putting this all together and coordinating and going through the clearance process and the ups and downs and ins and outs of that. I'll hand it over to Jonathan. Thank you.
Okay, look, I just want to thank you so much, everyone, for coming. If you have any follow-up questions, you can email them to ehnexus@cdc.gov. We'll try to get the recording up as soon as we can on the Nexus website. And that's it. Thank you. And great questions from everyone. Hope you all have a good day.